Hello, everybody. I'm Emily Firsty Swanson. We're live at Cookin At the O. We have missed you all so much. Gosh, I can almost feel you like you're all jammed in here at the O, at what we call the Sardine Club, and we're just getting ready for an amazing time. You are just going to love this music, and you're going to love why we're doing it, because these great healthcare workers up here have been taking such good care of us, and they just ask us to take good care of them, you guys. So you know what? Do this thing. Do it when you're with me at B&B, and do it because I'm old, and because you can, and you should, and I love you, and those are all the reasons. So that's why we're here with you, because we love you, and thank you, all our healthcare workers.
Yeah, Emmy. So good to be with all of you tonight. As Emmy said, we wish you were right here in the beautiful Oldenburg house with us, but you can't be here. So we're coming to you. Thanks for joining us. There are girls just right for some kissing, and I mean to kiss me a few. All these girls don't know what they're missing. I've got a lot of living to do. And there's wine all ready for tasting. I hope you're having a glass. Shiny Cadillac, so new. Gotta move. Time is wasting. I've got a lot of living to do. There is music to play, places to go, and people to see. Everything for you and me. Life's a ball, if only you show it. It's all waiting for you. Gotta move. Time's wasting. I've got a lot of living to do. Everything for you and me. Life's a ball, if only you'll show it. And it's all waiting right there for you. Gotta move. Time's wasting. I've got a lot of living to do. Got a lot of living to do. Once again, good evening to all of you. I'm here with my dear brothers, Mr. Billy Peterson on the bass, who I've known for several years now, but not nearly as long as Glenn Swanson, who's on the drums tonight. And the three of us started making music for the first time last night. And we are having such a ball, because I had never played with Glenn before. Billy and Glenn have played together for many, many, many years, and this has been such a ball. So I think we'll talk a little bit more after we play this one. A beautiful song from a 1960s musical called Do Re Mi. It goes like this. Make someone happy. Make just one someone happy. Make one heart the heart you sing to. One smile that cheers you. One face that lights when it nears you. One girl you're if you win it, it can come and go in a minute. Where is the real stuff in life to cling to? Love is the answer. Someone to love, that's the answer. Once you've found her, build your world around her and just make someone happy. Make one someone happy, and you will be happy too. Fame, if you win it, comes and goes in a minute. Where's the real stuff in life you can cling to? Love is the answer. Just someone to love is the answer. Once you found her, build your world around her, and make someone happy. Make just one Beautiful. Ladies and gentlemen, thanks again so much for tuning in tonight. We found out that before the broadcast even started tonight, $2,700 was already raised, and the production money for everything that happened tonight was already raised as well. So every dollar that you contribute will go right to these hospitals that are in need of your help tonight. We're so grateful to be able to play for you tonight for such an incredible cause, to raise money for all these incredible healthcare workers that are every day dealing with this pandemic. And so please, if you can, give some money to these hospitals to help the incredible people that are keeping everybody healthy as possible, and literally saving people's lives every day. We're going to play one more tune for you, and we are going to then introduce our first guest for tonight, our first person that's going to speak a little bit about their work. This is a wonderful tune by Alan and Marilyn Bergman. And I think you're going to start it, my friend.
You want me to get you in there?
Yeah, let's do it.
All right, brother.
When lonely feelings chill the meadows of your mind, just think when winter comes, can spring be far behind? Beneath the deepest snows, the secret of a rose is merely that it knows you must believe in spring. Just as a tree is sure its leaves will reappear, it knows its emptiness is just the time of year. The frozen mountain dreams of April's melting streams trust it's on its way. Just as a sleeping rose awaits the kiss of May, so in a world of snow, of things that come and go, well, what you think you lack, you can't be certain of. You must believe in spring and love. You must believe in love and trust it's on its way. Just as a sleeping rose awaits the kiss of May.
I can, yes.
So in a world of snow, of things that come and go.
Okay.
Well, what you think you lack, you can't be certain of. You must believe in spring and love. We have our very first guest here. This is Dr. Charity Reynolds, and Dr. Reynolds is from the Fond du Lac Reservation Clinic, and I think she has a message for us now.
Good evening. I'm Dr. Charity Reynolds. I'm the medical director for Fond du Lac Human Services Division in Cloquet, Minnesota. We have, as you are well aware of and may know, that Native Americans are at greater risk of complications of COVID-19 due to historical trauma. Human Services Division, the medical team, and the tribal leaders got together and learned as much as possible about COVID-19 and to be able to protect the community, to be able to protect the elders, those that hold the history and the culture of the Fond du Lac community. They were able to put in right away travel restrictions, having social distancing, screening employees, and being able to have universal masking for everyone. We continue to stay up to date on COVID-19. We have curbside testing for our population, and we continue to stay up to date about how to better serve our population. We, as the rest of the country, are working on having enough personal protective equipment so that we can serve them better. We also have telehealth services. So we ask that you continue to think about others and thinking about protecting those that need the best protection. So please stay home as much as possible, wear your mask, wash your hands, and socially distance. Thank you.
Let someone start believing in you. Let her hold out her hand. Let her find you and watch what happens once someone who can look in your eyes, see into your heart. Let her find you and watch what happens. Cold. No, I won't believe your heart is cold. Maybe just afraid to be broken again. Let someone with a deep love to give that deep love to you. And what magic you'll see. Let someone give her heart. Someone who cares like me. is cold, maybe just afraid to be broken again and again. Let someone with a deep love to give that deep love to you, and what magic you will see. Let someone give her heart, someone who cares like me, someone who cares like me. Yeah, boys. Mr. Billy Peterson on the bass, Mr. Glenn Swanson on the drums. My name is Andrew Walesch. We're so happy to be back with you here tonight. We have a couple more tunes to share with you before our next guest. This next tune has long been a favorite of mine by a great songwriter by the name of Bart Howard. Many of you probably know this tune, made popular by Frank Sinatra, but I'm going to do something a little bit different with it here. I hope you like it. Poets often use many words to say a simple thing. It takes thought and time and rhyme to make a poem sing. With music and words I've been saying, I've been playing with them and making a song to be sure that you know what I'm saying. I'll translate as I go along. Fly me to the moon and let me play among those stars. Let me see what spring is like on Jupiter and Mars. In other words, hold my hand. In other words, darling, kiss me. Fill my life with song and let me sing forevermore. You are all I long for. In other words, please be true. In other words, I love you. Fill my life with song. And let me sing forevermore. Because you are all I long for, all I worship and adore. In other words, please be true. In other words, I love you. I could have danced all night, I could have danced all night, still have begged for more. I could have spread these wings, done 1,000 things I've never done before. I'll never know what made it so exciting, how all at once my heart took flight. I'll only know when she came up and danced with me. I could have danced all night. made it so exciting. How all at once this little heart took flight. I only know when she came up and danced with me, I could have danced. Could have danced. Could have danced all night. Surprised you guys on that one.
Yeah.
A great song from My Fair Lady to end our little set there. We'll be back in just a few minutes, but now we're going to hear from Dr. Chris Delp. And Dr. Delp is from St. Luke's Hospital.
Good evening, everyone. I'm talking to you from St. Luke's Emergency Department. It's another busy day in the emergency department. Fortunately, we've got plenty of staff to take care of everybody today, but it is very busy, and we're happy to be taking care of everyone. First of all, a quick shout out to my amigo Glenn and his beautiful wife Emily. I miss coming to the Oldenburg house for their music. That's some of the best times that my wife and I have had. Fantastic music. We miss that. We miss a lot of things during this pandemic. I miss hugging my mom. It's very difficult. I think it's more difficult for everyone else in the community because they don't see it. Unfortunately, I see it every day today. And so I just want to thank you for doing your best to maintaining that social distance, even though you can't really see how sick these people are. So I really appreciate that. What we're doing today in part is raising money for St. Luke's Foundation. Our executive director, Catherine Huber, has asked me to say just a few words about this because the money that is being donated goes to some great causes. We're getting new and adaptive equipment and personal protective equipment as well. And I think that this pandemic has brought out the best in our community. It really has. What we've seen is and where some of these funds go is for innovation to our local companies. We have here some of the things that keep me safe. We have from Frost River, they have one of the essential components of personal protective equipment called a Papper Hood that keeps the virus out and keeps me safe. And Frost River was able to retool and get this into the hands of all of us in the emergency departments in absolute record time. And connected to this in cooperation, we have another device that filters the air and brings it into the hood. And this is actually developed by Cirrus. And together we have from two of our local companies putting together this equipment to keep us safe and continue to be able to care for people. So doing this, helping pay for lab, for personal protective equipment, we're repurposing space for this surge, and everybody is saying, maybe the surge won't happen, and it is, and we're seeing it now. So now more than ever, it's important to keep your distance. And just to stay strong for a little bit more, so we can manage this surge. So I want to say thank you to all of you that are watching and enjoying the music. I really wish I was there enjoying the music as well, or just able to listen to it. But we will get through this. We will listen to that great music again and be together. And hopefully I can toast you all from a more close distance in the future. Thanks again from St. Luke's.
And thank you so much to Dr. Chris Delp. We actually can't hear the speakers, but everybody's telling us how incredible their words are. And again, we are so grateful to these incredible health professionals for all the great work they're doing. We're going to play a song now by a songwriter that some of you might not be hip to. His name is Dave Frischberg, and he's still with us. He lives out in Portland, Oregon, but he is from St. Paul, Minnesota, lived out in New York for many years, wrote lots of great tunes for all kinds of wonderful artists, and we're going to try one of those tunes for you now. And this is a song about what we hope you're doing right now, sitting on your couch at home, relaxing and having a little taste, a little glass of wine or whatever suits your fancy. This is how this goes. 2, 3. A little taste might hit the spot. A little taste might help a lot. It may be nice, but maybe not. In my condition, this is a risky proposition. A little taste might pave the way. It has been known to save the day. One little taste might be okay. It's a sedation for a sticky situation. Why not spare myself a little pain? Why lock my appetite out in the rain without a shirt? Who said self-denial's all that great? It sure wasn't me. 'Cause I found it often pays to dissipate. One little taste could make a whole lot of difference. Maybe it'll ease the bite. One taste could help me make it through the night. Good evening, friends. Why let those good intentions get my goat and bring me down? When I know a great potential antidote. One little taste could change my whole disposition. A little taste might break the ice, make the nasty seem like nice. A little taste just once or twice, it's an enhancer. One little taste could be the answer. And so it shouldn't be a total waste. Waiter, I think I'll have a little taste. Put it on her tab. That's right. That came from Nat King Cole, you know, because he did that great. He had that great hit, the Frim Fram Sauce, and at the end of it, he said, "And I'll take a check for the water." That was his line. That was his line. Anyway, we're going to play a favorite song of Mr. Glenn Swanson back on the drums. After all, he's the one that invited us to play it as part of this wonderful series, and we look forward to playing with Glenn, maybe down in Minneapolis. Who knows where the next time, and coming back to this beautiful place. This is such a lovely setting out here, and it's so great to be up in northern Minnesota. I haven't been up here in a while, and the wildlife and the rocks and the trees and the incredible things that you can find in the woods that you can eat, like wild leeks.
Yes.
And we just have had such a phenomenal time. So again, thanks for tuning in tonight. The proceeds for tonight, the donations that you make are going to the hospitals. I think 5 different hospitals that have been, four different hospitals, excuse me, that have been hit hard by this terrible pandemic. And the incredible staff at these hospitals have been there through this whole thing, and they're going to continue to be through all of this to help all of these folks, to take care of these folks. And so you can show them your appreciation by making a contribution. All of the money that you donate will go right to these 4 hospitals. With that, here we go. Some Cole Porter for Mr. Glenn Swanson. Night and day, you are the one. Only you need the moon or under the sun. Whether near to me or far, no matter where you are, I think of you. Night and day, why is it so that this longing for you follows wherever I go? In the roaring traffic's boom, in the silence of my lonely room, I think of you. Night and day under the height of me, there's an oh, such a hungry yearning inside of me. That torment won't be through till you let me spend my life making love to you day and night. Night and day. Under the height of me, there's an oh, such a hungry yearning inside of me. This torment won't be through till you let me spend my life making love to you day and night. Till I spend my life just loving you day and night. till I'm with you every morning, evening, every afternoon, every day, every season, till I am with you night and day. Thank you, folks. Once again, Billy Peterson on the bass today.
Thank you very
Such
much.
a wonderful, wonderful, such a wonderful, wonderful musician, and always a great pleasure to play with him. And of course, Mr. Glenn Swanson on the drums here. My name is Andrew Walesch. We're going to play one more tune, and I think we're going to hear from another guest. So onwards here. I think we're going to do, let's do the COVID song. We call this the COVID song because you're supposed to stay at home and not leave the house. And so you don't get around much anymore. In the immortal words of Mr. Duke Ellington, until this thing passes, it's better to stay home. And it's not such a bad thing to say you don't get around nowadays, at least for the foreseeable future. Here we go. Missed the Saturday dance, heard they crowded the floor, couldn't bear it without you, don't get around much anymore. Thought I'd visit the club, I got right up to the door, I just couldn't walk in there without you, don't get around much anymore. Darling, I guess my mind is more at ease, but nevertheless, why would I stir up all those old memories, been invited on dates, could have gone, but what for? Don't get around much anymore. Come on, Bill. Oh, my baby, I guess that my little mind is made up and it's more at ease. Nevertheless, up all those old memories. I've been invited on days I could have gone, but what for? It's different without you, and I can't bear it without you. It's so different without you. I don't get around much anymore. Don't get around much Ladies and gentlemen, we have another guest to speak to us now. This is Dr. Ken Ripp, and Dr. Ripp is from Community Memorial Hospital.
Hi, I want to thank Emily and Glenn for giving me a chance to speak. I'm Ken Ripp. I'm a family doc here in Cloquet. You know, I really love what Glenn and Emily have done at the Odenberg with the fine food and the outstanding entertainment. I really look forward to getting back to their live shows sometime in the future. So Glenn and Emily asked me to come out and talk a little bit about what has changed for medicine for me and what I see the future of medicine with this pandemic. So the pandemic has been brutally hard on everyone. It's created change at lightning speed, which is always a challenge and causes stress. Overnight elective procedures and routine office visits stopped. As a family physician, I work in several different capacities and entities, from the hospital to the clinic, to the nursing home, to the ambulance service, to the county jail. And I've witnessed people just working so hard to prepare for this pandemic, and we're starting to see it roll in now. I'm proud of the healthcare team and how much time they have given and their expertise to get ready for this. It is challenging just to try and keep up with the changing recommendations, and we're all trying to constantly improve our knowledge and be best prepared to care for our community. I believe that the measures that we've taken so far at the state, town, and school levels have really helped slow this virus down and has spared our community of an overwhelming surge. And it's allowed us critical time to get our supplies up and to get ready to plan for what's going to happen next. Things have really changed at the clinic for me. You know, patient volumes initially fell off almost to zero. We're now wearing personal protective equipment with every visit and are working hard to clean like never before. The protective equipment is not new for us, but the wearing it constantly and the amount of protection is. It is a challenge because it does put a little bit of barrier between us and our patients, and it's hard to sometimes read the patient's reaction, and even interacting with providers with masks and respirators on sometimes can be a challenge. And I can only imagine how frightening it is for our patients to be cared for when they're sick and maybe a little bit confused with a team of providers dressed in full protective equipment. Don't get me wrong, this protective equipment is absolutely critical because healthcare workers are getting sicker at a higher rate and are having worse outcomes than the general population. So although this is a barrier to our care, it is absolutely necessary. The use of this protective equipment will be going on for the foreseeable future. So at the clinic, we have different groups meeting constantly to try and discuss the changing needs and how best to care for our patients. We're trying to adapt to this change with the pandemic. We had to alter how we collect certain samples, and now we have a fish house out in our parking lot to collect certain samples. Our Coumadin clinic is now going out to meet our patients in their car to collect their little blood sample. People have been very adaptable to these changes. I want to thank all the healthcare workers who have been made these changes without much complaint. We have a new telehealth link at our clinic, and that's been a change. It took a while to work out the technical glitches, but overall, it works. It is fun to get a tour of some of my patients' house when we're on the phone. So telehealth is not going to go away, but it cannot completely replace that one-on-one personal interaction that happens in a clinic. So it has been hard to deal with critically ill patients, and it is really asking a lot of our healthcare team to put themselves at risk. Many of our 46% of healthcare workers are now altering how they interact with their own family. Some are not even going home anymore. That is sad. We don't want to get ourselves sick, and we certainly don't want to get our families sick. It boils down to this: good science will help us figure out the ins and outs of this virus. Good science will find treatments that work and those that do not. Good science will hopefully lead to an effective vaccine in the near future. For those at home, it can be a very stressful time with all these changes. Please be safe, wash your hands, reach out by Zoom and whatever other methods you have to keep in touch with your family members. Know that our healthcare community is trying desperately to protect you, your family, and especially our senior members in our community. I know that is only with science that we're going to get through this. Glenn and Emily, look forward to seeing you again real soon. Thanks for this opportunity.
One. Well, let's do it a little slower. Yeah, perfect. Sorry, folks. Here we go. Something happens to me in your arms when I can feel that you are near. It's a strange kind of a chemical force that goes rushing through me. I know somehow you have appeared. Then, baby, something happens to me in your arms when I can feel you're grooving too. I can tell that you've been caught in the spell that I am under. We gaze into each other's eyes with breathless wonder to see that when something happens to me, it happens to you. Something happens to me every time I can feel that you are near. A strange kind of a chemical force goes rushing through me. I know somehow that you have appeared. Then, baby, something happens to me in your arms when I can feel you're grooving too. I can tell you have been caught in the spell that I am under. We gaze into each other's eyes with breathless wonder to see that when something happens to me, it happens to you. something happens to me. Something happens to me. It's a mysterious something. It's a crazy thing. It's a wonderful thing. It's so fabulous thing. It's a crazy thing. It's a wonderful thing. It's a wonderful crazy thing. Then baby, something happens to me in your arms when I can feel that you're trembling too. I can tell you have been caught in the spell that I am under. We gaze into each other's eyes with breathless wonder to see that when something happens to me, it happens to you. When it happens to me, it happens to you. Fun, boys.
Yeah.
We'd like to try a song next that is just about, I think, the most wonderful thing in the world. And it's the simplest thing in the world as well.
Don't even talk about that one.
Smiling.
Oh, smile.
Just like you're doing right now. Just a big, wonderful smile. It can heal just like music.
That's right.
A simple smile. And it's a very, very old tune. And we'd like to try it for you now. Key of C.
Yeah, baby.
When you're smiling, the whole world smiles with you. When you're laughing, sun comes shining through. But when you're crying, you bring on the rain. Stop your crying, be happy again, and keep on smiling. When you're smiling, well, the whole world smiles with you. When you're smiling, when you're smiling, the whole world smiles with you. When you're laughing, the sun comes shining through. When you're crying, you bring on the rain. Stop your crying, be happy again, and keep on smiling. When you're smiling, the whole world smiles with you. While the whole world smiles with you. Nice, guys. Well, I think we'll do one more very quick one. And our next guest isn't quite ready yet, so we'll play one more beautiful love tune for all of you. And then we'll enjoy another statement here. Let's do that beautiful Antonio Carlos Jobim tune. It goes like this. Just one time. Quiet nights of quiet stars, quiet chords from my guitar, floating on the silence that surrounds us. Quiet walks by quiet streams, quiet, lovely autumn dreams, and a window looking out on Corcovado. Oh, how lovely. This is where I want to be. Here with you so close to me. Till the final flicker of life's ember. I who was lost and lonely, believing life was only some bitter tragic joke I've found with you. The meaning of existence. Oh, my love. This is where I want to be. Here with you so close to me. Till the final flicker of life's ember. I who was lost and lonely, believing life was only bitter tragic joke now I've found with you. The meaning of existence. Oh, my love. I've found the meaning of existence in your arms. I've found love at last with you. For our next speaker, we have Miss Donita Corpella, and Donita is from Mercy Moose Lake Hospital.
Hello, my name is Donita Corpella from Mercy Hospital. I'm the Director of Patient Care Services at the hospital, and I've been there for 24 years, so it's been a long time. I just want to extend a thank you to Emily and Glenn for their generosity by putting on this music event. It's been a great event, and the music is wonderful from what I've heard. The money raised is definitely able to assist our staff and other hospital staff to care for their patients safely. And in this time that everyone is worried about exposure and things happening to them and going home to their families and bringing these things to their families as well. I think the community has done a great job in collaborating. I've definitely been a great part of collaboration between hospitals in the region, hospitals in the state. We've all pulled together and worked really hard. It's constantly changing. Some of these changes that we've seen have been technology. As you can see tonight, we're doing so much more over the technology. And yes, you lose a little bit of that face-to-face contact, but it's definitely keeping people safer at this time. The technology has allowed us to provide that care, collaborate with one another, and really be there for each other in this time where we can't touch each other, feel each other. We really want to socialize, and that technology has really brought us together. The community donations have been just absolutely overwhelming and thoughtful from our community to all of our staff. We've got everything from Girl Scout cookies that were just, even some of the Girl Scouts themselves just wanted to donate to the staff to show their appreciation and their thankfulness for us continuing to work and help those that they love. We got school children, the local schools brought thank you cards, and we got them posted in our facility just to keep people cheered up and know why we're doing what we're doing. The community is also, CDC is always has recommended source masking. So you come into a hospital and you're going to get a mask, and our community has donated so many masks to allow us to offer them to our staff and our patients. This is just one of the masks that we have. They're great. They help us keep each other safe, protect each other, and they also do cover some of our PPE that we're wearing in the hospital to keep that clean, because we're reusing equipment. But with the monies that are donated through this, then we will have plenty of PPE and plenty of supplies for our staff, so we can continue to take care of our patients the way that they need to be taken care of. It has changed the hospital. We haven't seen too many patients in the hospital. In some areas, it's totally shut down other areas. So we're very anxious to get people back and start doing our work and start providing our care to our community that we do a good job of. Some of our community members have put signs up, Heroes Work Here signs, in recognition of our staff and They're posted out right by our Mercy Hospital sign. And so every day you drive in, you know, the staff are heroes at this time, and we appreciate everything that they're doing. So I'm glad I was able to be a part of this event and to show our appreciation and your generosity in helping out your communities and helping us work together. And we will get through this together and work together to be as safe as we can. So enjoy your time, properly social distance. We've been doing a great job, and our hospitals really do appreciate that. So thank you very much, and have a good evening.
My story is much too sad to be told. But practically everything leaves me totally cold. The only exception I know is the case when I'm out on a quiet spree, fighting vainly the old ennui. And I suddenly turn and see your fabulous face. I get no kick from champagne. Mere alcohol doesn't thrill me at all. So tell me, why should it be true that I get a kick out of you? Some get a kick from cocaine. I'm sure that if I took even one sniff, it would bore me terrifically too. But I get a kick out of you. I get a kick every time I see you standing there before me. I get a kick, though it's clear to see you obviously, you do not adore me. I get no kick in a plane, flying too high with some girl in the sky is my idea of nothing to do. But I get a kick out of you. Get no kick every time I see you standing there right before me. get a kick, though it's clear to see you obviously, you do not adore me. I get no kick in a plane, flying too high with some girl in the sky is my idea of nothing to do, nothing to do. I get a kick, you give me the boot. I get a kick out of you. Thank you so much, ladies and gentlemen. Next, we're going to hear from Chris LaFleur, and Chris is from Riverwood Healthcare Center.
Hello, everybody. This is Chris LaFleur from Riverwood Healthcare Center. I'm just here to say thank you very much for being a part of this live stream that Oldenburg Arts and Cultural Community is putting on. I want to say thanks to Glenn and the boys. Some awesome music, of course. Tell you a little bit about Riverwood Healthcare. We're a 25-bed community access hospital. We have 3 primary clinics with 40 physicians from a wide range of specialty service lines. We offer 24/7 emergency department with a level 3 trauma center. We're located in Aitkin, and we serve Aitkin County, Garrison, Mille Lacs Lakes area, and surrounding communities. We are actively monitoring COVID-19 with a strong focus on patient safety and infection prevention. Over the last 9 weeks, we have developed policies and procedures to ensure safety for our patients and community residents. Of course, the residents in the community are the big part of keeping the spread of this COVID-19 down, and we want to really thank you for being part of that process by practicing your social distancing and washing hands, wearing masks, all of that stuff that keeps this virus from getting out of hand. Again, I want to say thank you to the donors and the listeners for being here. Also let you know that on April 6th, Riverwood rolled out our virtual video visits with our patients, and that's been doing great. May 11th, we've resumed elective surgical procedures, and we now have extra precautions in place, including separate entrance and exits for the surgery patients. We're very fortunate in that Aitkin County has had very low incidence of COVID-19, and thanks to the communities across central Minnesota for working hard on in this unpredictable time, we've kept that low, and we'd like to do that some more. If you need any more information or updates, please visit our Riverwood website at www.riverwoodhealthcare.org. And in the meantime, enjoy the jazz. And thank you very much again to the Oldenburg House and the Oldenburg Arts and Cultural Community Center. We appreciate all that you do. Stay well, be well.
So fucking old school shit.
Yeah, it is.
Folks, we'd like to thank you so much for joining us tonight. This has been such an enjoyable evening for us musically, and I hope you as well. But listening to all of these incredible testimonials from these people that are working day in and day out in the hospitals has been, I think, the most incredible part of this whole evening. So if you can, please click the donate button, and again, that money goes right to the 4 hospitals And these hospitals are in need of resources right now during this challenging time. So if you can do that, that would be so wonderful. We're going to sign off tonight with a beautiful song from the 1940s. I think of it kind of as a little bit of a lullaby. We're back tomorrow, 7 p.m. Tell your friends. Put your dreams away for another day. And I will take their place in your heart. Wishing on a star never got you far. And so it's time to make a new start when your dreams at night fade before you. Then I'll have the right to adore you. Let your kiss confess this is happiness, darling. And put all your dreams away. So it's time to make a new start. And when your dreams at night fade before you, then I'll have the right to adore you. Let your kiss confess this is happiness, my baby. And put all your dreams